Hello, friends. Thank you and welcome for participating in our third session of diabetic. Sorry. It's our third year of promoting health awareness in community about the diabetes. One of the biggest challenges faced globally is diabetes, which is largely a consequence of family history, the improper diet, lack of physical activity, and sedentary lifestyle. To make this interesting for the participant and religiously follow the diabetes management program, RAC Hospital, a premium healthcare facility, brings the RAC Diabetic Challenge 2024. So in this connection, today's our webinar is all about the diabetic challenge. Our speaker, Professor Adrian Kennedy, is well-known wellness expert working in Arabian wellness for last 13 years as Chief Wellness Officer. He's a multifaceted person with a vast experience in the area of corporate wellness. He started his career as a sports person and was national champion of India and represented Asian Championship in 100 and 200 meters. He's a member of team that swam the English Channel from England to France. Not less, there are many other things. He's also a member of organizing the committee in Asian and Commonwealth Games organized in India. He served as Director Executive Health in Tata Steel, and that was a starting of a corporate wellness. And then he became Managing Director Apollo Life. He pioneered corporate wellness in India and now spreading in the Gulf country as well as globally. Not spending much of more time, I hand over to Professor Kennedy. Professor, over to you.
Okay. Am I in now? Yes. Thank you. Thank you. Friends, usually, first of all, I would like to thank Dr. Wilku for that very kind introduction. Thank you so much, Dr. W. Usually, we say the thank yous at the end of a session, usually. But today, I would like to take the liberty of saying thank you to the 5,000 participants who have registered with us for this 2024 edition of the Diabetes Challenge. And I would also like to say a special thank you to those of us who have registered for this webinar. And we have these webinars every week. I will be using our website as a representation of Unveiling Diabetes, okay? And the credit for this goes clearly to, could we have the welcome note, Neha? Yes, just there, that's fine. And the credit to the Diabetes Challenge must squarely rest with Dr. Raza Siddiqui, who is the group CEO of the Arabian Healthcare Group. And the reason why he embarked upon servicing the community with diabetes is because the UAE is 15th in the world out of the 200 or 300 nations that are out of the 200 odd nations that comprise the world, we are ranked 15th in the world, and 19% of our population is diabetic. Now, this website that you are looking at is an excellent resource for diabetics to utilize. Could we have about, please? Yeah. Now, over here we have, good. This challenge is for diabetics, and it's been defined as individuals with HbA1c of above 5.7, or from time to time, we may accept in our corporate groups or in our OP category, individuals with a fasting blood sugar of above 200. We have divided this event into 4 or 5 different registration categories. You have the physical participants. Now, these individuals come to the RAC hospital and register, and we just completed that process on the 9th, 10th, and 11th of this month, where over 1,000 individuals came to the RAC hospital and had the opportunity of doing a free HbA1c check and registering for this event. Beyond that, we have the virtual category, in which you can register from anywhere, and that virtual category would include individuals from living in Dubai or Abu Dhabi. You can register in any clinic and have it duly certified. We also have our entire corpus of 2,000 or 3,000 individuals in RAC hospital, patients over the years who have diabetes. So we service that group. And then we are one of the lead providers for corporate health, and we cover 10,000 lives every year, of which at least 1,000 are diabetic. And so we service that community. Totally, we have about 5,000 participants. Now, you can register physically, as I've mentioned, and our registration was on the 9th, 10th, and 11th. You can register virtually, sitting at home, checking, having your blood sugar levels checked with the clinic. You can register from there, and our OP clients and our corporate clients are in our database. They are automatically registered. Now, by registering, what is our objective? I'm sure you would imagine that the objective for the Diabetes Challenge is to win awards. But that is not the most important reason why we conduct this challenge. It is only 2 or 3 or 10 or 50 individuals who might win the coveted cash award. And that award, of course, is given to the top 3 winners in the male and female category. Physical, 5,000 dirhams, 3,000 dirhams, and 2,000 dirhams, as the case may be. The winners of the virtual category receive staycations and vouchers from our various sponsors, and they could enjoy the weekend at one of our 7-star facilities. And of course, the top 50 would perhaps receive a free medical check or some such restricted facility within RAC hospital. Maybe the top 10 or top 20 would receive these awards. But this is not the main reason why we conduct this championship. We conduct this championship for the 5,000 individuals who are registered, to whom we make available webinars such as the one you are sitting at, and health tips which go out to them every week. And of course, registration is free. The corporate team gets the award for the maximum numbers of individuals who participate, and a corporate team comprises of not less than 10 individuals. The award function will always be, or so far has always been, on the World Diabetes Day, which is on the 14th of November. Criteria eligibility. Everyone above the age of 18 is eligible to participate. We require you to have to take the support of your physician. In this particular event, we do not consider any surgical procedures for reducing weight and such things. So there our medical team would evaluate eligibility, and so far we've had comfortable acceptance. Rules and regulations. There are several rules, but I will touch upon just 4 or 5. One, all participants have to register so that we are able to account for each individual on the in the event. Individuals can register physically by coming to RAC Hospital, and the benefit of that would be a free HbA1c at the start of the event and a free HbA1c at the end of the event to see how well they have improved. Virtual clients, which run into the thousands, may take the HbA1c, which is the primary requirement for participation. They may do it at any clinic as long as it is appropriately certified. We do the medical screening in corporates, and we have done the medical screening for our own OP clients, and therefore they are automatically registered. And of course, there is no registration fee. So registration, participation is easy. I mentioned earlier that there were great benefits in the website, and this comes largely from the various resources that we make available in the website. Now, if you were to click onto the website on the topic of health resources, or the vertical of health resources, you will see the various health tips that we provide. We provide these health tips not only in English, but also in Arabic, and we provide them every week. And we don't take down the previous year's tips. So you have about 3 months, 4 weeks. In a month, that would be about 12 tips every year. Over the last 3 years, you would have about 30 or 40 health tips. And these are exciting tips. They are in English and Arabic. Counting calories is what is on your screen. And then you have diabetes control, or you could have superfoods. Now, what is a superfood? A superfood is a food that, besides its benefit, it burns more calories than it gives you. So you actually lose weight by eating those superfoods. How do you manage sweets? What type of exercises should you do? And I must tell you, friends, these tips are the brainchild and the baby of Dr. Wilku, who was kind enough to introduce me. And if thanks are due, the thanks for the health tips are certainly due to Dr. Wilku. Health information. We have an excellent compilation. We have an excellent compilation of readable information to the layperson. Now, this is healthy lifestyles brought out by the WHO. We have something on the medical management of diabetes, and this is so important. It talks about insulin. It talks about pills. It talks about surgical procedures. Information that you could never get easily is available on the website. You don't need to search for it elsewhere. And then we talk in terms of methods of testing. What is fasting blood sugar? What are the ratios that you need to have? What is random blood sugar? What is the HbA1c test? This is excellent information that any diabetic would like to have, like to comfortably see. And then, of course, there is the recent documentation by the WHO where it classifies diabetes across the world. And then, of course, we have videos. Now, these videos are videos of general content. It relates to diabetes for sure, but it is of general content. It is not related to the webinars, for example, which are very specific. During the course of the year, our various executives and our various doctors talk about various aspects of health. Now, those aspects that they talk about several times touch upon the diabetic aspect of good health. And therefore, we picked up from that vast repository information, 10-minute or 12-minute or 5-minute videos that talk about health in relation to diabetes. And this library of videos is available for you to see. There are videos here by the ophthalmologist and the psychologist, the physician, and so on and so forth. Webinars. This brochure that you are looking at is today's webinar. Every week we will have webinars, and these webinars will be conducted by eminent faculty such as cardiologists, endocrinologists, diabetologists, surgeons, dietitians, and so on and so forth. You can see over here we have diabetes and metabolic syndrome, Dr. Hala, the role of hypoglycemic diet in diabetes management by our dietitian. Then you have yoga. Then you have holistic care, which Dr. Wilco will take. Then you have diabetes and heart health, which our cardiologist will take. Then our ophthalmologist will have diabetes, eye care, and so on and so forth. This entire range of webinars is awaiting your audience during the course of these 3 months up to the 1st of November. There may be minor changes in case the speaker is not available on that particular day. But broadly speaking, anything that you want to know about diabetes will be made available to you by our weekly half-hour webinars, in which the faculty are eminent and experienced individuals. Oh, I noticed over here the archive. Now, this archive is the webinars that we have conducted over the last several years, which means in this instance, over the last 2 years. So you will see our webinars from 2022 and 2023. And now we are adding to that. And there are almost 25 to 30 webinars over here. That will be 12 to 15 hours of valuable information. And you have renal health, you have diabetes and foot care, diabetes and retinopathy, diabetes and heart health, alternative remedies for diabetes, that's alternative therapies for diabetes. You have exercise and diabetes, you have diabetes and neuropathy, you have the entire range of connectivity with medicine and diabetes available at your disposal by simply looking at these webinars. The press has been very kind, and we have over 100, I would say over 100 press reviews over the last several years. These reviews that you can see are for this year itself. And then there is 2023 and there is 2022. And what is the sum total of what the press is saying? The press is highlighting, number one, that medicine in diabetes is important, but they're also emphasizing that lifestyle change is so valuable in the management of diabetes. We are talking in terms of managing your diet. They are talking in terms of managing exercise, the psychological management, and all these other lifestyle-related aspects. As a matter of fact, lifestyle is a major factor in the management of diabetes. And the third, and perhaps the most important aspect, is proof of concept. Do challenges like this work? Do people actually succeed in managing their diabetes through events like this? Now, our event is based on education. We make available all the information we can through specialists and experienced individuals so that the patient or the client is able to manage their own diabetes very comfortably with the help and support of their doctor. Without fail, we have discovered that on an average, from 7.8 diabetes, HbA1c from 7.8, the entire population, and our population comprises of almost 100% diabetics above 5.7, in this population of 5,000, with some of our participants having a blood sugar reading, having an HbA1c of above even 14. We have consistently managed to average a starting of about 7.8 in this entire 5,000 population. And at the end of 3 months, we have an unbelievable reading in the range of 5.03, which is non-diabetic, which means that many of the finishers, the majority of the finishers, and the finishers run in hundreds, are able to actually reduce their blood sugar levels to a non-diabetic ratio. The contact us location tells you that you can contact us through email, and we get hundreds of emails from our participants asking many questions, and support@rackdiabetieschallenge.com will give you a quick response within 24 hours while we route it through the specialist concerned. You can also call us, and experienced professionals will manage your call. So friends, I would strongly recommend that you use this website as a resource in managing your diabetes. This information is available to you. The information of previous years' experiences are available to you. And every week during this 3-month period, new information is logged into this website. I would strongly commend I would strongly recommend that you utilize this website as one of the means by which you manage your diabetes. Thank you so much for your kind audience. Dr. Wilku, thank you, sir, for giving me this opportunity. Dr. Wilku, if you have any questions or if any of the participants have any questions, I will be happy to attempt to answer those questions.
Thank you, Professor Kennedy, for walking us through the diabetic challenge. It was short and clear. I think there should be no confusion for any query. Still, if anyone has any query, please ask in the chat box. Let's see. Yep. We got one.
It says my HbA.
Yeah, Param has asked, my HbA1c is not being displayed in the site. How to get the report?
I participate in this challenge also. And I asked exactly the same question. I did. When I got my report, when I did the HbA1c, I got a note in my mobile which said that your HbA1c test has been done. Please contact your doctor for details. Now, I didn't know which doctor to contact. So I simply asked support at ragdiabetes.com. I called the number and I said, what exactly do I do? Because it is not displaying my HbA1c. And they said, don't worry. In 48 hours of your doing the test, you will have your results displayed on your site against your name, and nobody else will be able to see it except you. So I am sure that Dr. Wilku and his team that are managing this website.
I just got, yeah, please continue, sir.
Go ahead, sir. I'm sure you will be able to support this participant who wanted his details.
Yeah, sure. Anyhow, because many of the times when the reports are being uploaded, it is not because it's a technical thing, it doesn't get fully synchronized, but you can still send your participation code, the registration number to support. We will just have a look why it is not being displayed. I just got one SMS from the participant who is not in this webinar now. She has asked, my husband's HbA1c is 5.6. Is he the part of challenge? Because we have mentioned 5.7 and above.
Dr. Wilku, can I answer this question, sir?
Yeah, sure.
If the lady's husband is 5.6, then I must congratulate him because he is certainly not considered diabetic. However, I would strongly recommend that he does exactly what we suggest everyone does. Just because you are not eligible for an award doesn't mean you are not eligible to get all the benefits of education, the webinars, and the health tips. So I would strongly recommend that you actually register. And in registering, you will get the vast benefits of being an associate of this project.
Yeah, in short, sir, both sides it is win-win situation. Whether you win good health, whether you win both health and wealth, both. There is one more participant. Zobia has asked, my HbA1c is 5.7. Is it pre-diabetic or is normal? This is very vast, common question being asked.
Dr. Wilku, go ahead, sir.
No, you can answer, sir. If you want me to answer, I will answer.
Please go ahead.
Yeah. So, Ms. Zobia, 5.7 is definitely pre-diabetic, but it doesn't indicate that you are going to suffer with diabetic if you don't take care. It's very easy because you are just stepped into the pre-diabetic zone. So, like Professor mentioned, use the resources we have given in the website, all health tips, you follow the health tips, follow all the webinars because you'll be getting a lot of information live, because every time even the experts, when they make any recommendation. Every time there is a new thing which comes up in the webinars. So definitely follow all those things and it will be fine. You'll be below 5.7. Definitely you have stepped in pre-diabetic zone. So please take care. It all depends on other problems also. If you have a strong family history of diabetes, if you have other hormonal issues, being a female, so that's the reason I indicated. Or if you have any other metabolic disorder in line, or if you are taking any chronic medication like for hypertension or for hormonal disturbances, then you will be more prone towards being diabetic. So it's just now step in. So take care of yourself, reverse it to non-diabetic. Yes, sir. I think there is no more questions. So thank you all participants, our core coordinating team, who is working very hard to go function this very good. Yep, sorry, I will just add one more question. Somebody with using a Lenovo has asked, how come a person with binge eating disorder and diabetes finds support? I just gained 60 pounds this year. I found doctors don't understand eating disorders.
Yeah, I absolutely agree with you. Binge eating, etc., is really a psychological problem. I wouldn't call it a psychological problem, but I will call it a psychological issue. So in case you have a binge eating habit and in case your weight you've gained 60 pounds, 60 kgs as I see it, step number one, you would need multi-medical support. But one, beyond your physician and diabetologist, you will definitely need the support of your psychologist, who will help you to understand why you are doing what you are doing and who will give you various ways and means by which you can manage your binge eating phenomenon. Dr. Wilku, there was also a question from Miss Anurupa, where she asks, what
Miss
is...
Anurupa has asked.
Yeah, you can go ahead, sir.
The pre-diabetic range. Yeah. Ma'am, pre-diabetic range starts from 5.6 to 6.49. Means 5.7 is pre-diabetic, up to 6.49 is pre-diabetic. 6.5 becomes diabetic. So after 6.5, it goes according to grade 1, grade 2, the severity it ranges. But up to 6.49 is pre-diabetic. 5.7 to 6.49. I think that was the last question. So again, I will thank you everyone for the participating in this webinar as well as the challenge. And thank you very much for coordinating team who is being very efficient for conducting, organizing all aspects we can support with diabetic awareness. So see you next week for our next webinar on diabetes and metabolic syndrome, because diabetes itself not as a small subject, it's a vast subject. So our endocrinologist, Dr. Hala, will be talking about all aspects of metabolic syndrome, which influence directly or indirectly the diabetes. Thank you very much.